all here today. We are going to be recording this so that we can post it to our website after. This is an event this is what we call an informative event that's hosted by our health and wellness community. And in an effort to keep on time, I am just going to hand the mic over to one of our leaders of our health and wellness community, Carrie Havey with the Green Engineer.
Thanks, Meredith. So welcome again, everyone. Today we have an amazing panel that's going to be speaking about PFAS in the built environment. We have a variety of speakers with different backgrounds and focus areas. So I think this is going to be a really engaging discussion on some of the issues surrounding PFAS. And the Health and Wellness Roundtable decided we wanted to do PFAS as a series because there's really so much to talk about on this topic. So at the end of our session today, we'll share and announce some of the upcoming PFAS sessions that we're going to have. So the format of today is each panelist is going to speak for about 10 to 15 minutes, and then we'll have question and answer at the end. So if you have questions as people are speaking, feel free to put those in the chat so we can start getting those list of questions coming in, and then we'll have time at the end to answer all those questions. I think that's all on logistics. So unless there's anything else, I think Jennifer, we're going to have you start us off. Jennifer Peterson is an executive director at the Massachusetts Waterworks Association, which is a nonprofit membership organization dedicated to the advancement of drinking water profession and a registered lobbyist in the Commonwealth of Massachusetts. So Jennifer, you want to take it away?
Great, thank you so much, and thanks for inviting us to participate today in this webinar. Mass Waterworks, we are a nonprofit. We're based in Acton, Mass, and we have over 1,400 members who work in public water supply. That is owners and operators and managers of public water systems, as well as those who work for those public water systems, consulting engineers, equipment manufacturers. We provide a number of expertise on a number of state committees, including several related to PFAS. And so happy to be here with you today and kind of talk about how PFAS is impacting our members. I thought maybe someone was going before me who would kind of set the stage for what is PFAS. I think hopefully everybody knows at this point that it is a forever chemical. It is a man-made chemical that we are finding in our environment because of its ubiquitous nature, and it is in all sorts of things that we use every day and encounter. We are seeing it in water supplies because it has made its way from that manufacturing process into the ground and into groundwater and into surface water. So in terms of PFAS regulation in Massachusetts, there's no current federal standard for PFAS. EPA has what they call a health advisory, which is non-regulatory, non-enforceable. So absent the federal government acting, Mass DEP decided to create its own maximum contaminant level in October of 2020. It was a couple-year process, stakeholder process, for them to bring folks together and look at PFAS, its health impacts, and to determine whether or not they were going to move forward with regulating it in drinking water. And they did. They set a standard of 20 parts per trillion for 6 compounds. They're listed here. I'm not going to read what they are. They're complicated, and I will undoubtedly botch them, but they are 2 of the most common that we see in the environment, PFAS and PFOA, as well as these 4 others. Mass DEP calls this the PFAS 6, and so that's how I'll sort of refer to it. It was set to be protective against adverse health outcomes for all people consuming water over a lifetime. I will say Mass DEP's drinking water regulations are complex, and it's put our members in a bit of a challenging situation, given that the science around PFAS has been evolving, the regulatory actions around PFAS are evolving, and because of this evolving nature of the science, Mass DEP decided that they would review their MCL within 3 years. So they passed it in October of 2020, and they have to do their 3-year review by the end of this year. Some of the challenges that our members have faced is communicating about PFAS. There are many more questions than there are answers at this point. Mass DEP is requiring public water systems when they detect PFAS above the PFAS 6 above the MCL of 20 parts per trillion to do a public education notice. And then if they exceed that 20 parts per trillion in a quarter, a 3-month period, then they have to do a formal public notice. The public notice language is scary. It is, some people who drink water containing PFAS 6 in excess of the MCL may experience certain adverse health effects. They list those potential health effects that Mass DEP had identified at the time. And then it goes on to say that consumers in sensitive subgroups, so those being pregnant women, nursing mothers, or people with compromised immune systems, not consume, drink, or cook with the water if it is above 20. So as you can imagine, when public water systems have to send out this notice, they get lots of questions from people who fall in those sensitive subgroups about, wait a minute, I've been drinking the water here for 10 years. What does this mean to me? And we don't have a lot of those answers. So it has been challenging. Mass DEP required all public water systems to test their sources as a result of this regulation. That was completed in 2021. So this map of the state shows where detections above 20 parts per trillion have been found. We have 170 public water systems who have exceeded the state standard. That means 18% of community systems. And so community systems are those municipal systems or the systems serving condo associations or people that they're, who drink the water all year round. And so have a fair amount of PFAS throughout the Commonwealth, a little bit less in Western Mass, obviously, than in Eastern Mass, but still it is out there. This map only reflects detections above 20 parts per trillion. It does not show all detections. And so we know that there are many more who have had detections below 20 parts per trillion. There is a website the EEA has, which uploads all of the drinking water data. Sometimes it's about 3 weeks behind because there's a lot of quality assurance that has to go into looking at the analytical results. So it is about 3 weeks behind, but you can go there and search for a particular town or water system and see what their results are. The good news is that PFAS can be treated in drinking water. There are several known technologies that will remove PFAS to non-detect levels. The most common is activated carbon. We call that GAC, granulated activated carbon. They are able to be regenerated, the media, but it has been seen to be less effective for shorter chain PFAS. So what it does is it sort of absorbs all the PFAS from the water, it binds into this media, and then every so often you will have to change out that media in order to be able to keep your treatment technology working. Reverse osmosis has been determined to be effective, but it's very expensive and very energy intensive. And there is a question about what you have to do with the reject water from the backwashing of that type of system. So we're not really seeing reverse osmosis being installed in Massachusetts. The third is an ion exchange resin. And so folks are typically piloting ion exchange and activated carbon within their water system to see which is more effective for getting them down below the standard. These are the sorts of carbon vessels that you will see installed at water systems. So while the good news is we can treat it, the bad news is it's very expensive to treat it. And I've just picked out a few of sort of the early adopters of this treatment to show what the costs have been that have been seen by these systems. So in Hudson, 4.3 million to treat just one of their sources. Mansfield, 4.2 million. Westfield is a $12.2 million project. And Littleton is about to do a ribbon cutting on a $24.5 million plant next week. So part of the issue in this range of costs is that because of the treatment technologies, sort of naturally occurring contaminants like iron and manganese need to be treated before they can treat for the PFAS. So Littleton's plant is removing iron and manganese from the water first, and then they're treating for the PFAS. So it's a multi-step process. These plants, we are seeing some on the order of $50 million in order to cover all of the water that they need to treat. There is funding that has been made available from the state through the state revolving loan fund. Key piece here is this is a loan fund. So what the state has decided is that they will recognize 0% loans for PFAS projects, but they still do need to be paid back by the ratepayers in these water systems and the communities. So, well, it's great that a typical loan is 2%, so we're saving that 2% interest, but we still have a significant cost facing our municipalities. The funding to date has not been enough to support all of the remediation activities that are going on. We are trying to also find responsible parties to the contamination who will hopefully pay for the treatment. That was the case in Hudson, where they had an industrial manufacturer that they were able to tie the contamination back to, and that industrial manufacturer had to pay for the cost of the treatment. The bipartisan infrastructure law, which you've all, I'm sure, heard a lot about, is going to provide some funding and some principal forgiveness to these loans, but that is largely focused on small and disadvantaged communities. So we expect to be seeing that rolling out this year. Just to touch on some of our concerns, there's been a lot of focus on PFAS in drinking water, but not a lot of education about other exposure points. And I'm sure Laura will talk a little bit about this in her talk. Having those differing standards from state to state has been difficult. And now, obviously, with EPA moving forward to regulate PFAS by the end of the year for 6 compounds, they are different 6 compounds than Massachusetts is regulating. So there's going to be this reconciling of, what are the suite of compounds that we are treating for, and what standards are we trying to meet. EPA is proposing 4 parts per trillion for PFOA and PFOS. So far, far below our 20 parts per trillion in Massachusetts. And so that has systems saying, okay, I've installed treatment that meets the 20, hopefully it's getting to non-detect, but how much will how frequently will I have to change out that media to be able to support getting my water to below 4 parts per trillion? We have seen variability in analytical results, which has been concerning. So we had one system who took sample from the source water, same sample, sent it to 2 different labs. They had an 8.9 parts per trillion difference between those 2 samples. So the way in which these labs are analyzing the water may be slightly different. Their equipment might be slightly different. So that's been challenging, especially for people hovering around that maximum contaminant level. Because of the influx of sampling, we have seen lab reporting delays, and the ongoing sampling costs have been significant. We are concerned about procurement law being a barrier to people being able to get treatment on quickly. So we've suggested the state might need to look at procurement law changes, and certainly supply chain issues have been a concern and will continue to be a concern as a federal standard rolls out and people across the nation are trying to get these carbon vessels and the treatment technologies. Because, Mass DEP has indicated that this is harmful to those sensitive subpopulations, they have suggested that water systems need to provide an alternative to drinking public water. And so in some cases that has been bottled water that has had to been distributed to those sensitive subpopulations. Some communities have decided to install basically a centralized filtration point, like they have a water filtration station at their fire station and people can come and fill up there. We were told when the standard was passed in drinking water that Mass DEP would follow up through their Bureau of Waste Site Cleanup on any detect over 20 parts per trillion to try and find where the contamination was coming from. But because we've seen so much contamination in drinking water, they haven't been able to timely follow up on that. Of the 170 public water detections we have seen, there's only been 49 response tracking numbers released for drinking water contamination. So that's obviously a concern because, as I said, in the absence of a responsible party, the communities are paying for it. we have had concerns, and obviously that's going to come to a head pretty soon, about designing systems for a standard that might change, and it will change by 2024. And so that will be a challenge for folks who already have these systems or who are currently in the midst of designing them. And then there are these ongoing operations and maintenance costs. There is some funding available for capital costs, but not for operations and maintenance. And so we are concerned about that. And overall, we are very concerned about the loss of confidence in the quality of tap water. We take great pride in the essential services that we provide. And so it really, it does hurt us when folks are afraid to drink the water, and we're obviously sensitive to that. If any of you are interested in that funding process, you can find more information on the Massachusetts Clean Water Trust's website in terms of how you access that state revolving loan fund. And the projects were just submitted in August. So the next opportunity will be June of next year to try and get into that competitive loan process. Real quickly, Mass Water Works was a member of the PFAS Interagency Task Force convened by the legislature. They met in 2021 and issued a final report in 2022 for how the Commonwealth could move forward with addressing PFAS. So there were 30 recommendations. They fall under the below areas. I'm not going to go into all of that, but omnibus legislation was filed. It is House 2197 and Senate Bill 1356. And you're certainly welcome to look at that and see if that will impact you folks. And the public hearing has happened, but the committee hasn't yet reported that out of committee. So if you have comments on that legislation, now would be the time to try and submit those or to meet with the legislators on that committee and talk about it. And with that, there's my contact information, and happy to touch on anything else that I may not have covered that people are interested in.
Thank you so much. Appreciate that. All right. So next up, we have Preeta. So Preeta Lundberg is the CEO and founder of the Lundberg Health Advocates LLC, which is a patient advocacy group, and she's the CEO and founder of Health Equity Institute, which offers education and connection to patient advocacy services for patients in need. So Mikhail Davis is the Director of Technical Sustainability at Interface, a global flooring manufacturer. He is responsible for building internal leadership capacity, providing technical assistance to customers on their sustainability efforts, and creating external partnerships in sustainability.
Let's see, am I unmuted first of all? Oh, good, I am. All right, we can build on that.
We can hear you. Yeah, there you
go. Great, so I'm gonna give you a little bit of a manufacturer's perspective on PFAS. So we make flooring, but we are known for, and we kind of invented the category of carpet tile. So if you buy your carpet in squares and rectangles instead of rolls, that is a category we invented. And to the degree that we can't claim that, we bought the companies in Europe that could claim that before us. So now we have that wrapped up. So what this, of course, is one of the categories in which you would historically find PFAS chemistry used in the coatings on the surface of the yarn, which I always like to point out to people looking at other chemicals of concern in carpet, like maybe focus on the one that you're touching that lasts forever, that comes off. Start with that. So it was sort of my gift from Interface was that the year before I joined Interface, they phased out PFAS on all the major yarn systems, which was 2010. We got an award from Building Green for that. And so that was great to have, as I'm answering all the complicated questions about, sustainability and plastic flooring, which is never easy. We had one where we could say, yeah, we don't use that. So that was nice. But since then, I've been asked to explain, including today, many times, how were you able to do that? Why were you able to do that, before any of the other companies? Which, of course, begs the question of why was it being used in the first place? Which is, in terms of the manufacturer perspective, a little bit of the world I want to let you into, which is the world of functional chemistry. So we tend to, as we're thinking about it in a regulatory context or From the standpoint of advocacy or avoiding health harms, we're thinking about the hazard profiles, like what health problems can this chemistry cause? Now, unfortunately, the average chemist, especially one in a manufacturing environment, has little to no training in that aspect of chemistry. That is not taught to the average chemical engineer or chemist in a traditional, setting or material scientist. John Warner and others have been trying to fix that for years, but I keep hearing John give the same talk in a different decade about how little education there is in terms of hazard profiles and green chemistry for chemists. So apparently it's not taking off the way he'd hoped 30 years ago. So functional chemistry, and this is really how you train chemists, or what does the chemical do? Okay, what chemical, oh, this is the thing we need the product to do. What chemical can help us do that? What is its function? And so you kind of need to overlay that and look alongside, if we're looking at, for instance, the whole world of alternatives assessment and saying, okay, is there a different way in terms of, the chemical hazard of this one versus that one? Could we accomplish the same function with a different, less hazardous chemistry? So there's lots of people working on alternatives assessment. But from the manufacturer side, when you look at PFAS, you have to look at what is the function of PFAS? Why has it ended up on so much stuff? And I can explain and even have a few slides I could show about exactly what it does in carpet, but fundamentally you're talking about chemistry that is highly water repellent, which is why you're going to see it in raincoats and other things. It is highly going to create stain resistance, which is why you're going to see it on certain kinds of clothing, especially polyester, which is very prone to the third thing, which is oil resistance. So this is actually the most difficult function to replicate in terms of what we found in carpet. PFAS chemistry, very difficult to stain it with oil. It will cause water to bead up. It will cause oil to bead up. Not every chemistry has that ability. It kind of usually does one or the other. PFAS can give you oil resistance and water resistance. And of course, with that, stain resistance. Can also, make the surface slippery. So you're going to have soil shedding. So if you don't want stuff to stick to it, also a very common use of PFAS chemistry. So if you are, for a particular application, in our case, carpet, if you were looking for a replacement for that, you have to say, okay, how do we replace that function? Because unfortunately, what the average chemist is taught to do is, how do I replace that chemical? So they're going to look for the chemical that is as close to the thing that they're replacing as possible. They're like, oh, we're not allowed to use PFOA. Okay, well, I'll find another thing that's as close as possible to the thing that we're replacing. Now, anyone who studies more of the hazard side of chemistry will tell you that that tends to often replicate the hazard as well. So that's kind of the mentality we're up against. And so I will have us back out into, one of my favorite topics for a second, which also highly deals with function, which is biomimicry, which is where we look at how do we replicate the function of something we do in human manufacturing or design, or even organizational design, works at all different levels. How would nature do that? How would nature solve that problem to accomplish that same function? So one of my favorite little biomimicry, do it this way. This is, and actually both of my kids in school right now are studying the periodic table. This is from the periodic table of elements. So these are in order of font size, the atoms that nature uses. So you can see that most organisms are made of carbon, hydrogen, nitrogen, oxygen, more than anything else. And then descending down into, phosphorus, sulfur, all these other ones. Now, if you notice on the very bottom row there's a little F. That's fluorine. That is the key atom in PFAS that distinguishes it from all the other things. Fluorine is used in living organisms, but quite sparingly. It's a potent thing. It is not used in every organism and lots of different molecules within living things. So, and that is in part because it takes a lot of energy to get carbon and fluorine to bind, and then they never come apart, as we've learned with PFAS. So this is a classic example of a chemistry that would never be used in nature. So You look at all the things it does functionally, and it is kind of legitimately magical. But if you look at the fact that it would not be found in nature, and basically every organism in nature takes a pass on eating it. That's why it is not biodegradable. That's why it lasts forever. There are no microorganisms that really want to break apart that, or have the ability to break apart that carbon hydrogen or carbon fluorine bond. So it's violating some basic rules of how nature does chemistry. How would we get that function otherwise? Since that is obviously not, and even as you've seen people use different coatings, it can replicate all of the properties, particularly oil resistance with water resistance, with soil shedding. Difficult to get all of those things together. But biomimicry would ask us to back off from that, and I'll show you a couple slides here just real quick, and say, okay, so the functions that we're trying to replicate, what would we do instead? So one of the things you consistently see in nature is that nature substitutes, rather than introducing a new chemistry, which might be highly energy intensive for the organism to synthesize all this chemistry, you often see use of the same material, but in a different shape, in a different physical shape. And so this is where we're going to look at carpet yarn just for a second. Here's going to nerd out on carpet for me just for a second. So this is where, for instance, this is a cross section of the teeny tiny fibers in carpet yarn. These are bundled into the things that you actually see. But the cross-sectional shape here, we call the modification ratio. If it's perfectly circular, it's 1. That's the ratio of the middle circle to the outer circle. Now, the important thing about this, and so you can see if you look on the far right, that's going to be more of your residential fiber. It's going to have these long, thin ears. And guess what happens to those long, thin ears when you walk on them? They're super fluffy, but they also break.
Hey, Mikhail, I don't think we're seeing your slide.
Well,
We're only seeing the title slide, the PFAS and functional chemistry.
Well, maybe we will skip this part then, since it's not working.
Unless you want to slide down to the slide that you want to show us, but yeah.
I'm moving the slides. You're obviously just not, it's not coming through.
Yeah.
In any case, changing the shape, the cross-sectional shape of the fiber causes it to be more durable and to shed soil better without coatings. So that's the first thing that nature would tell us about solving our functional property of having your carpet last longer and not trap soil, is change the shape of your fiber. Don't necessarily add a new chemistry, especially one that nothing in nature wants to break down. Because one of the lessons we get from biomimicry in terms of chemistry is that there's plenty of toxic things in nature. Think about spider venom. All of it is readily biodegradable. If spider venom drips on the ground, fungi and bacteria, something's going to eat that. Something's going to break it down. In the case of PFAS, we've created something that nothing wants to break down. It is roundly rejected by all of life in terms of being something that could be a food source. Even fungi take a pass on it, and they'll eat anything. So one of the things you also started to look at it, and I had a few cool slides of what carpet yarn looks like under a microscope. It starts to fray a little, and the first thing that frays is anything you put on the surface coating. So if you make the yarn really shiny with a coating, or if you make it water and stain resistant with a coating, as soon as you start walking on it, that starts to fray. One of the first things we noticed that was at the beginning of our journey to phase out PFAS is that one of the things that happens with these water resistant coatings is the coating frays, and then dirt gets under the coating. And then no matter how many times you clean that carpet, the stain doesn't come off because the stain is under a waterproof coating. So there's a very sort of practical reason that we went down the road of phasing out PFAS. So the other thing you realize is that one of the other really energy intensive processes in dyeing fabrics or yarns, and very chemical intensive, is of course the dyeing. And you take your white fiber or your white cloth and dye it a particular color. Lots of chemistry, not all of it benign, involved in that. So we made a 100% commitment to what's called solution dyed or pre-dyed nylon in our face fiber, which essentially means that rather than dyeing white yarn, you were taking the pellets and adding dry pigment to those pellets creating, for instance, blue pigment or blue pellets, and then extruding the blue pellets into blue yarn. And then the color goes all the way through. It lasts a lot longer. It's a lot more UV resistant. And we don't have to worry as much about the color coming out or fading. We're less worried about staining because we can now use what's called a sulfonation process. We essentially bind all the dye sites in your nylon. And so you can no longer dye it, but if it's already the color you wanted, from your pre-dyeing, that's fine. But it also makes it much more difficult to stain, especially with an acid-based stain, which of course is what, think about Coca-Cola or coffee or something. But those are also most of the traditional dyeing processes for white yarn and carpet are also acid-based, bind to the same dye sites in the nylon. If we've eliminated those through the sulfonation, you'll also hear it called cationic nylon. You don't need a stain resistance coating. And by the way, whatever stain resistance you have is never going to wear off because it's now inherent to the nylon. It's not a coating. So that's kind of the journey.
1 minute heads up. Sorry. Just giving you a heads up. Sorry.
Was that a time check?
Yeah, sorry. Just a 1 minute time check.
I always need a time check. So I think the PFAS question, I always like to make sure we introduce the functional part of it, because you do, and in some cases you just say, like, oil resistance in 3-dimensional textiles is just not that big a deal. Now, when you have a flat textile, especially a polyester, which loves to absorb oil, then you have a bit more of a functional challenge. If you have a flat textile that oil is routinely going to be spilled on, now oil resistance becomes an issue. For 3-dimensional textile, a lot of that, which is carpet, a lot of that sinks into the pile. You're going to be able to clean some of it out, but it just doesn't show up in the same way. So I've talked to friends who work more on textile side. The oil resistance is a bit more of a functional challenge. But on the carpet side, you really just have to say, how necessary is this really? Which of course is something we always have to ask in these green chemistry challenges, especially when the hazard becomes clear, or even just incredible persistence. Because of course, that's the way we usually find out about the worst chemical mistakes we've made. We're like, this stuff is everywhere. It's not going away. Hope it's not toxic. DDT, PCBs, any number of these persistent organic pollutants. And I think we're now definitely on that journey with PFAS. And we need to kind of get that genie back in the bottle to the degree that we can, come up with solutions to clean it out of all the places it's building up. But first and foremost, get people to stop using it, especially where it's not really adding any functional value that's essential. So
great. Thank you so much. Appreciate that. All right. Next we have Brita, and I think Ryan, you've got her slides ready to go now.
Wonderful. There they are. Beautiful.
All right. So Dr. Brita Lundberg is the CEO and founder of, I guess I've already done this, so I'll just
introduce myself, because that was
yeah.
like the intro for this slide, because I'm really representing Greater Boston Physicians for Social Responsibility here. I'm the chair of the board at GBPSR. GBPSR is a group of nationally recognized experts in public health, cancer epidemiology, occupational health. And we have worked to raise awareness among the medical community and the general public regarding the threats to human health by chemicals like PFAS. Next slide. Which I think of as Trojan chemicals, kind of like the Trojan horse in Greek times, where a wooden horse was brought into the city of Troy, and wow, what was unleashed. So this is what was unleashed. PFAS is the acronym for per and polyfluoroalkyl substances. It's a class that includes thousands of chemicals that contain at least one fully fluorinated carbon atom. As other speakers this morning have said, the carbon-fluorine bond is the strongest bond known to man, and it makes these chemical compounds exceptionally resistant to degradation, which has made them deserve the moniker forever chemicals, and that's an image of PFOA. Next slide, please. So we are exposed via multiple pathways. The most common pathway is via water, but we're also exposed via air, soil, and food. The first PFAS were used, many of you might not know, but in nuclear weapons development by the Manhattan Project during World War II. And that led to the discovery of a plethora of other applications and wide-scale use in thousands of products, including today weapons, nonstick products, most notably, probably everyone knows about Teflon, artificial turf, clothing, leather, carpets, food packaging, firefighting foam. What some of you might not know of that is that it's not only in some pesticides, but it also leaches into pesticides from the containers that they're held in. It's in fracking fluids, which you have to bear in mind because a lot of fracking fluids are repurposed as road salt in many parts of this country. So since they're in there, you're breathing those in. And then biosolids or fertilizer that are spread on agricultural crops. As one resident from Michigan said in testimony to the National Academy of Sciences, if you think you aren't exposed, you're dead wrong. And how exactly are we exposed? Well, as the previous speaker said, through the air and dust. It can be inhaled. PFAS can aerosolize from carpets and upholstery. It can be ingested or absorbed through the skin, in water and food. It can leach into food from packaging, as I mentioned, leach into pesticides from containers, but also be incorporated into certain pesticides. It's in fertilizer. And as speaking as a physician, it's in medications, it's in joint prostheses and breast prostheses. So it's in a lot of stuff. This is particularly concerning because in patients like infants and toddlers and children, they have a lot of hand-to-mouth behavior, and that's a significant source of exposure. And it's present in the blood of almost all those who live in the US. Over 97% of the US population have detectable levels of blood PFAS. Next slide, please. So the mechanisms of disease, it doesn't necessarily explain all of the health effects, but two general mechanisms that we know of are that PFAS can methylate DNA, which impairs gene expression. And super interesting, it can act as a free fatty acid mimic. You can see PFOA at the bottom and a free fatty acid on the top, octanoic acid. And they look a lot alike. And that's a real problem because a lot of free fatty acids are bound up by albumin. And albumin distributes those free fatty acids everywhere in the body. So everywhere albumin goes, those free fatty acids or PFAS is going to go. It's also important because free fatty acids are an essential energy source during exercise and pregnancy and starvation. So if they're being bumped off albumin, you're not absorbing them. They're required for insulin secretion, and elevated free fatty acids, which you would expect to see in cases where you've been where you have high exposure to PFAS and free fatty acids have been therefore bumped off albumin, are, say, prevalent in patients with type 2 diabetes. Next slide, please. So as you might guess by those mechanisms, the associated health harms of PFAS exposure are broad. So epidemiologic and toxicologic studies have linked PFAS to reproductive harms, endocrine or to developmental harms, as well as some cancers. The health effects of exposure that occur during gestation or early childhood may not be obvious until years later. And high-risk populations include children, pregnant women, industry workers, and those who live or work near high-risk facilities like military bases, shipyards, chemical plants, refineries, and airports. And what are those health effects? Well, they include the reproductive, maternal infant health harms, such as infertility, preeclampsia, which is just high blood pressure during pregnancy, low infant birth weight. Endocrine and immunologic disruption can lead to liver toxicity, endocrine disruption, including type 2 diabetes, early onset puberty, thyroid disease, and immune suppression. Very interestingly, there was a study out of the Faroe Islands showing an impaired vaccine response among children who had high levels of PFAS. There have been harms to neurocognitive development in children that have been described, including decreased IQ and a number of malignancies, including kidney and testicular cancers. And after I saw an interesting story about hepatocellular carcinoma in such a young child in the New York Times last weekend, I was just curious to look at hepatocellular carcinoma. And indeed, there's just been a report of increased hepatocellular carcinoma among patients who have increased PFAS exposure. Next slide, please. I just thought I should say a word or two about equity. So there was a recent article out of the Harvard School of Public Health noting that Hispanic and non-Hispanic Black communities are most likely to have community water systems contaminated by PFAS. And then I should also make the point that while both wealthy and low-income communities can be affected, wealthy communities are more likely to be able to afford the high cost of mitigation measures like water filtration. So the harms of PFAS and the ability to respond to them are both exacerbating existing health disparities in our country. Next slide, please. And those costs are significant. So water mitigation costs, as Jennifer Peterson mentioned earlier this afternoon, in Cambridge, that came to the tune of $2 million a month just to source their water from the MWRA per month. Hyannis installed a water filtration system for $10 million, Barnstable for $20 million. But those costs are completely dwarfed by the economic costs of the health effects in the US, estimated by NYU researchers to be between $5.5 to $63 billion annually. Next slide, please. If you take two take-home messages from this talk today, I'd like you to take the following. First, that there's no safe level of exposure. According to EPA, there is no safe level of PFAS because, like the neurotoxicant lead, like the carcinogen benzene, like the respiratory irritant particulate matter and radiation, the health effects of PFAS are seen at every level of exposure. The other message I'd like you to take away is that mitigation works. When water filtration systems are installed, local levels decrease. One study in Minnesota showed a nice subsequent decreases in population blood levels and increases in infant birth weight and number of full-term pregnancies. Next slide, please. How to prevent your exposure: avoid highly packaged and processed foods. Require that as already happens in Massachusetts, although not for private wells, municipal and private well water is tested. Be aware of levels of contamination in the community, especially if you're breastfeeding, and consider a blood test if local levels are high, which incidentally should be covered by insurance in the best of all possible worlds. In New Hampshire it is. And to ban PFAS as a class. Next slide, please. My final takeaway: PFAS pollution is ubiquitous, and I hear people use that as a reason to do nothing and sort of inspire a feeling of helplessness. But I hope that my talk today, if anything, should inspire the opposite, because the host of illnesses that they spawn are not inevitable, they're preventable. Just like lead and secondhand smoke, tobacco smoke, people said those were inevitable. We couldn't get rid of them, but when we did as a society, those were incredible public health success stories with decreases in lung cancer and increases in childhood IQ. Next slide, please. I'd just like to say a word about GBPSR advocacy. We're addressing PFAS contamination using a systematic public health approach of education, mitigation, prevention, and advocacy. Will really benefit all communities across the Commonwealth. And I encourage you to take a look at our white paper on the GBPSR website. Next slide. And these are just some resources that I'm happy to point you toward and that are present on the website. Next slide. And then I'm happy to take any questions at the end. Thank you.
Great. Thank you so much, Brita. Appreciate that. All right, Lisa, you are up next. I have your slides, I think, ready to go here. Let me check.
Thank you, Carrie.
Where's... All right. That's not what I want. There we go.
There we go. That's my first slide. Excellent. I wanted to thank everybody for coming today and for our previous speakers. I think this is a really interesting and helpful topic. So I think I know most of the people on the call today, but in case I haven't met you yet, my name is Lisa Goodwin Robbins, and I'm an architect and spec writer at Kalin Associates. And so I've been spending a lot of time trying to figure out how to avoid PFAS and other nasty chemicals in our building products. I'm also the board chair at Silent Spring Institute, which is a nonprofit science organization committed to preventing exposures that cause cancer. Next slide. This is one of my favorite things from Silent Spring is this pathway to prevention concept. And I think Dr. Lundberg hit on this, that people often throw up their hands. We were both speaking at a city council meeting against toxic artificial turf in Newton. And the dad who was sitting on the bench next to me just kept saying, everything causes cancer. I can't do anything about it. We need turf. And it's like, that's really not the point. I want to focus you on the middle part of the slide in the green, where that's where we in the AEC community can actually make our mark. We can actually do something about what the scientists figure out and create better health outcomes for everybody. If you think about, that if you can change one thing on your project today, and then you can change things in your office or your firm as a practice, and then you can change things at your community, that you're actually making a difference by paying attention to this, which I think is the point. Can I have the next slide, Carrie? So here's our strategy. We're going to pay attention to the work of people like Silent Spring and other scientists. We're going to work towards legislation. We have new legislation in Maine. We have pending legislation in Massachusetts, and I expect Minnesota will be coming along shortly. And third is don't select and don't specify PFAS on our projects. And that's how we're going to approach this legislation in Maine. We've been getting a lot of calls. Some of you may have projects in Maine already. So the first thing is it's not possible to do a PFAS free spec, not any more than it's possible to do like a PVC free spec. And I have 15 Living Building Challenge projects, and none of them are Living Building Challenge Red List free, but we're working towards getting better. One other thing, it's sort of a big question with the Maine legislation is, what are we going to ask for as evidence of PFAS free? I think that's a bit of a challenge. Next slide, please. So we all know how to read declare labels and HPDs, right? And there are these cute little things on the internet that help you learn what's there. Declare counts things to 100 parts per million, and health product declarations count to 100 or 1,000 parts per million. But our current measurements for PFAS in water are measured in parts per trillion. So I'm a little confused about that. The chemical companies are complaining that the federal government hasn't set any standards, which is exactly why the states are setting standards, but the states are all setting different standards for different chemicals. And according to the International Living Futures Institute for Living Building Challenge and the Declare label, they're up to about 12,000 different kinds of PFAS. There are more, but most of our test kits only test for 6. So I'm looking at these two documents thinking these would be the easiest ways to say we either have PFAS or we don't in our product, but I'm wondering if we need another line on each document that says, does your product contain PFAS? And then what about all these companies who don't want to do declare labels and HPDs? Or what about all these products that we use on buildings that don't really talk to architects? It's a little challenging. So I'm thinking about that. But what we can do today, next slide, is we can start to avoid things that have PFAS attached to them at the end of their life. So the photo of the top photo is the Harvard Alston Science Center. The furniture throughout the building is all PFAS free. And you remember when Mikhail described how you can get stains under the coatings and then they never come out? The Harvard maintenance staff is actually finding that the furniture that doesn't have the stain repellent treatment on it is easier to keep clean because it doesn't have that trapping. So we have lots of PFAS-free options for fabrics, including upholstery, draperies, fabric-wrapped wall panels, carpet from Interface and other companies. Because, you know, there's a Saint-Gobain factory in Merrimack, New Hampshire, and it's getting ready to close. And the only thing they do there, I think, and I'm relying on a news report, is they take fabrics and they dip them in giant vats of PFAS and they let them dry and they send them back to the manufacturer. So if you think about that, that's an easy way to avoid PFAS. We will skip the fabric manufacturers can skip that one process. And if you have enough of something, a lot of the fabric manufacturers will custom run a line without it. There's an organization called Healthcare Without Harm, Safer Chemicals Program, which is what used to be called the Healthy Hospitals Initiative Guidelines. And sometimes you can Google like a fabric manufacturer's name and HHI compliant, and you can get their list of what works and what doesn't. Next slide. These are the things that we can't avoid right now, or some of the things we can't avoid. Solar panels, roofing and waterproofing membranes, Teflon tape for plumbing. If you ever do a plumbing project at your house, please never put the Teflon tape in your mouth. And all sorts of, every kind of paint on the market has PFAS in it. Factory applied, field applied. And this gets back to the talks of parts per million or parts per trillion, because paint is a liquid product. I'm trying to figure out if some paints have less PFAS than other paints, and the Healthy Building Network is doing some research on this. So hopefully we'll get some more information from that. Silent Spring opened an office in Hyannis to do some testing, some PFAS testing with people who live in the area, and they really wanted to paint the new office space with PFAS-free paint. And I think we could only find one latex interior paint, just the base paint. We couldn't add colorants to it, so it's a lovely shade of not quite white, and that's about it so far. But this shouldn't stop us from our goal of healthier building products for everyone, because if we don't pressure manufacturers to innovate, why would they change? So we're working on this and we're making progress. Next slide. I wanted to talk briefly about toxic artificial turf fields, and I am always going to call it toxic artificial turf from now on, just to sort of prove the point here. What's really toxic is the green plastic blades are coated in PFAS. The PFAS is run through the extruder with the fake grass, and the infill layer and padding are recycled crumb rubber. These photos come from recent demolition at Newton South High School, where they are recycling the artificial turf, and it's not going to be recycled. But here's a lovely photo of it entering unprotected into the storm drain, and then the toxic chemicals spilling in the highway, not the highway, that's the driveway to the high school. And I know you can't tell it, but my kids went to school here, and the water runoff goes right back into the wetlands next to the high school. I have lots of resources. If anybody wants to jump on the no more toxic artificial turf bandwagon, let me know. And here's some more information. The PFAS Exchange has fact sheets, community resources, and a data interpretation tool. Home Free is a great resource from Healthy Building Networks. It's really useful for talking to your clients or building owners in like really everyday language. Safer States is a cool place to find which states have passed which laws. Unfortunately, our code consultants aren't always in the know about PFAS and chemical flame retardant laws, because this legislation doesn't come to us through the building code. It comes through us through legislation for the state. And the bottom thing is the Green Science Policy Institute 2021 report about where PFAS is hiding in building materials. And that's about what I've got today. Carrie, who's next?
All right, thank you, Lisa. I appreciate that. All right, we've got Laura next. Laura, do you want to try and share your screen? Let me know if you need help. If you're talking, I think you're on mute there. And while Laura's getting set up, she's a senior policy advocate at Clean Water Action, where she coordinates advocacy issues related to environmental health and building decarbonization. You're still on mute, it looks like, Laura.
Okay, I'm unmuted. Sorry
Yay.
about that.
All good.
Now, can you see my screen?
We can.
Except for it's a mess. Hold on.
No
Let's get
worries.
all little things unclicked. Oh, sorry about this. Not. Help. I'm sorry about this.
Oh, that's okay. It happens. Let me know if, it's easier to send it to me. Totally up to you.
If you have it, it might be easier to send to you just if this doesn't go away.
I think did you try the slideshow feature there?
Yeah, you know what?
It's
my screen is frozen, so it's not.
Oh, okay.
And I don't entirely know why. Let me see if I can get rid of this.
I have it pulled up on my screen, Laura, if you want
do?
me to just share.
Here, let me just try 1 second if I can do it. Yes, I think I do want you to share. I'm sorry to be
No problem.
It happens.
Tech illiterate. But while that's coming up, I just want to mention I did not focus on the turf bill in this presentation, but I want to since Lisa brought it up. So what I am going to do is I am going to talk mostly about this one big bill that has been introduced and is the most in Massachusetts is the bill most likely to go forward. There is a smaller bill to ban PFAS and artificial turf. It would be great if architects weighed in on it. I can send information about it to Lindsay, and so she can forward it to other people in the group. Brita and some other people here have already weighed in. Artificial turf is very controversial, and it's strangely hard to get parents to hear that it's hazardous. But I'm going to focus on this one big bill, and it's not impossible that artificial turf could be added to it. But yes, as Meredith and Lindsay said, I'm Laura Spark. I work with Clean Water Action, which is a national multi-issue environmental nonprofit formed in 1972 to pass the Clean Water Act, and have continued to work on a range of environmental issues since that time, with a particular focus on issues that are that impact health and social justice. So next slide. And so obviously PFAS is a big, messy problem, and governments all over the world have been grappling with how to deal with PFAS. And the issue is, as Jennifer said, I think it's both addressing the PFAS that is already out there in water and in other environmental media like soil, air, wildlife, fish, own bodies, and preventing the problem from getting worse. Next slide. So in the United States, at the federal level, there has been some important movement. As Jennifer said, the Environmental Protection Agency put out this new proposed national drinking water regulation in March. It's still proposed. They're taking comment. And if that national drinking water regulation goes forward, it would lower the amount of PFAS, PFOA, PFOS, the first two PFAS that were introduced, and 4 other PFAS to really extremely low levels, almost at the level of detection. They've also proposed designating PFOA and PFOS as hazardous substances. And just a moment on nomenclature, PFAS is the is the acronym for the class of per and polyfluoroalkyl substances. And then PFOA and PFOS are perfluorooctanoic acid and I think perfluorooctane, I forget. Anyhow, but those are the first 2 of the large class of PFAS that were introduced in the 1940s. Those are the 2 chemicals that we have the most information about because they've been studied longer. And that's why those 2 are being designated as hazardous substances. So the Department of Defense has also eliminated the requirement to use PFAS-containing firefighting foam. While there's a range of ways that drinking water has gotten contaminated, some of the places that are most contaminated are drinking water in communities around military installations where and firefighting training academies where they used firefighting foam not to fight fires, but actually in training exercises that firefighters were required to do quarterly. So there has been some important progress on the federal level, but because of very strong industry lobbying, the kind of political divides that are keeping other important things stuck, it has been extremely difficult to move protective toxics legislation at a federal level. Next slide. So as a result, states are where the action is, particularly when passing bills. So in Massachusetts and other states, a number of states have set legal limits or maximum contaminant levels, to use the correct lingo, for the amount of PFAS in drinking water. And they did that before EPA. Also, 27 state attorney generals have filed lawsuits against chemical manufacturers and the manufacturers of PFAS-containing firefighting foam, going after them for their role in contaminating the environment. And also multiple states have since 2018 been enacting restrictions on PFAS in firefighting foam and consumer products. And some of the most active states are listed below. Oh, can we go to the next slide? Oh, I see there's a big turf conversation, which I'll try to go quickly so we have time for that. So in 2018, states began focusing on how to, as we say at Clean Water, turn off the tap, stop just making and using stuff with PFAS, which in general at Clean Water is our message, stop making and using stuff with PFAS. So first, states focused on firefighting foam because that was a known source of drinking water contamination. And a number of states passed significant bans, banned the manufacture, sale, and use of PFAS containing firefighting foam. An additional group of states have banned it just for training. Other states then looked at where the greatest amount of PFAS was being used and where people were being most exposed. They focused on carpets and rugs because the thought was that there was a very large volume of carpets and rugs using PFAS, and also on food packaging. Food packaging for the obvious reason that it was a source of exposure. PFAS in food packaging goes from food packaging into food, into us. And so those were the sort of second area that people were looking at. Then people began looking at personal care products because that's an obvious indication of a use that is not necessary. And then began to look at other specific products. But as states were looking to go after PFAS by product to product bans, scientists were doing research and beginning to understand the full range of products that PFAS is in. Next slide. And in particular, a group of Swiss scientists were able to use patents and company literature and a lot of other resources to figure out that PFAS are in fact in 200 different industry sectors and thousands of products. And based on that research, it became clear that we could not successfully go after PFAS by regulating product by product. So the European Union first announced that they were planning on getting out of PFAS by 2030. And that was just sort of a goal that was put out there. And then Maine took action and they were able to pass a comprehensive PFAS ban. And I'm going to skip over this because I don't have a lot of time and not give a lot of details, but we can always come back to this at the end if we want. Essentially, Maine passed a bill that is a model for what we are looking to do in Massachusetts. And then Minnesota in 2023, the spring of 2023, did the same. Next slide. So as Jennifer said, the next couple of slides are, I've got about 5 minutes more, are on what we are proposing to do in Massachusetts. So first, there was a PFAS interagency task force. Jennifer sat on it, and it was convened by Senator Sear from Barnstable, Representative Kate Hogan from Stowe. They both live in communities that have been impacted by higher levels of PFAS in their drinking water, primarily because of firefighting foam, but in Representative Hogan's case, also due to industry. And they convened this task force. They took testimony from business and the water providers and highly impacted communities and scientists, and they created this report, as Jennifer said, with 30 recommendations. And then Senator Sear and Representative Hogan introduced an Act to Protect Massachusetts Public Health from PFAS, which they said was taking the recommendations from the report and putting it into legislative form. One thing I just want to point out, because I don't think we have time to cover it today, is that the report and the legislation does not really address disposal. And disposal is another big, messy problem because we do not really have any good way of disposing of PFAS. It can be burnt, it can be put in landfills. Some has been put on agricultural, has been used for agricultural application, which has caused severe contamination in Maine, unknown contamination in Massachusetts, definitely used on farms in Massachusetts. And when I say PFAS, PFAS containing sludge. But so we don't really have a good answer yet for how to safely dispose of PFAS so that it does not get back into the environment in a different, in some way. So next slide. So the bill that Massachusetts has put forward is a very strong one, and it is one that is going to get enormous industry opposition. And the reason it's going to get industry opposition is Maine passed a bill that is very comprehensive, but Maine actually has a relatively small population. Minnesota was sort of the next state to fall. They have a larger population. But Massachusetts, we also have we're relatively small, but we have a large population, large consumer population. And I think as more states move in this direction, industry is going to feel more threatened. So our Massachusetts bill that is pending and that we are supporting, the first thing it does, it provides a fund to test and treat both private wells and public drinking water systems, and to test in drinking water, groundwater, and soil. And the idea is that that proceeds from lawsuits and other funds will go into this remediation trust and will be used to help communities pay for the very expensive remediation that they need to do. Next slide. And then the next thing that it does is it limits environmental releases. So PFAS gets into the environment in a variety of ways, and one of the ways it gets into the environment is just direct releases. And I'm forgetting the exact number, but I believe we have over 2,000. Actually, you know what, let me take that back. We have, I'm not sure, we have a number of sites of direct releases. It's not fully known what they are. And part of what the bill does is it requires a DEP to either require the elimination of PFAS use or the use of various technologies to prevent releases to groundwater and surface waters. Next slide. Then the next three slides are sort of the key pieces and the pieces that industry is really going to go after and the ones that we are trying to very strongly support.
Laura, just a 1 minute time check.
Oh no, okay, I'm talking. I might go over just a minute or two just to get through. Is that going to be okay?
Yeah, that's okay.
I apologize. So the first thing that this bill does is it on products, it requires manufacturers and distributors of products made, sold, or distributed in Massachusetts to disclose if they use PFAS. And they also have to label PFAS containing products. That obviously would be much easier for architects as well as others. The bill numbers is on the title page, and I will also send it around. Next slide. The next thing it does is it combines the categorical ban approach and the comprehensive approach. First, it categorically bans PFAS in a number of products. These are all what we consider to be sort of low-hanging fruit. Other states have already banned PFAS in these products, and we are hoping to get PFAS out of all of these sooner rather than later. I'm not going to read this because I'm running out of time. The one thing that I would note that we would be an innovator on is firefighters' personal protective equipment. As Lisa knows, because Lisa and I work very closely, we have also been working very closely with the firefighters. They are highly contaminated with PFAS, both because PFAS is in their is in firefighting foam. It's also in their personal protective gear. Ironically, and there are very high rates of cancers, particularly testicular and kidney cancer, in the fire service, and they are fighting very hard to get it out of their equipment through a ban. The bill also bans use of firefighting foam just for some purposes. We are working with the sponsors to expand that. And then, and this is the part that is really relevant to architects, it bans intentionally added PFAS in all products as of January 1st, 2030. Next slide. But it sets up an exemption process, allowing the DEP to temporarily exempt products from the ban if the product is essential for health, safety, or the critical functioning of society, and PFAS alternatives are not reasonably available. So examples of that would be a number of medical devices, very much like the building sector. PFAS is all over the medical sector, and things like refrigerants and air source heat pumps. So we know that we've been evolving refrigerants, ever since they were introduced. They were natural, then they were CFCs and HCFCs and HFCs and HFOs. And now what we have is we're using refrigerants that are fairly high GWP, global warming potential, but they're also PFAS, and they break down into something called trifluoroacetic acid, which we do not want more of. So that's a problem because we're obviously, as part of the green transition, we're all kind of moving to air source heat pumps. So in the short run, we're going to be these are the refrigerants we're going to be using. But as I think you probably already know, there's already an effort to move to safer refrigerants in different applications. There are safer refrigerants at different scales. There's less available currently for air source heat pumps. Europe is moving to natural refrigerants, and so there probably will be answers in the future. There just aren't right now. So this exemption process allows, as Brita said, allows allows the transition to happen. And what we are going to hear from industry is that PFAS are absolutely essential. They're essential for the green transition. They're essential for medical care. They're essential in semiconductors. And if you don't use them, the world will fall apart. And part of what we are trying to say, and particularly having professionals who are architects say, is that these technologies have always evolved. And we are going to, yes, R32 does. And we are going to need to move beyond current technologies as we've been doing. And if there are places where we can't move, if there's a hard implant or something that we can't move beyond it, maybe we don't slowly. But what we need to do is to have that addressed in the administrative process. And what I think industry is going to say is, no, exempt all medical products now, because we absolutely need PFAS in them. And so we're going to be trying to push back on that. And that is really sort of where we're at right now. We definitely think that a PFAS bill is going to get passed. It's going to be, have these categorical bans. Hopefully it will phase out, try to phase out most PFAS by 2030. And what we need to do is push back on efforts to get certain sectors exempted permanently. And also, and this is a little bit more in the weeds, to push back on there are going to be efforts to narrow the definition of PFAS, narrow the definition of intentionally added PFAS. We're trying to expand it to be intentionally used. And so a lot of the fights are going to fight out in sort of the technical weeds. Next slide. But the last thing that we're hoping that folks will consider doing is just voicing their support for action on PFAS by signing the petition, if you haven't already, to the Public Health Committee, saying that you want this bill to be passed out of the Public Health Committee, sending an email to your legislator. You can personalize it. This is one of those, action alert. You just hit it and it sends a message, but it's best if you personalize it. You can delete everything that we've put in there and put in your own message. And I think that email also includes the two bills that we're focusing on. One, which is on toxics in children's products. If you don't want to weigh in on that, you can just weigh in on PFAS by cutting the toxics in children's products part out, or you can just click send, and then just forwarding the email to 5 friends. Those are 3 things you can do in 5 minutes, and they will have an impact. And the last slide. If you have more time, these are 2 things that we ask people to do. Send a handwritten card. It's huge. When people get handwritten cards, they love it. Over half of legislators have co-sponsored these bills. You can check on the links to see if your representative and senator have co-sponsored. If they have, you can thank them and then ask them to resist industry pressure to weaken the bill and to keep supporting it. And then, of course, you can always go and talk to them, which is always the most impactful thing, to have a meeting, to show up in constituent hours and say, we really need to get these chemicals out of the products that we use every day and the products that we're putting in buildings.
Thank you so much, Laura. I appreciate that.
Thanks for talking too long.
No, this is important to talk about that advocacy piece. That's great. I really appreciate that. We want to make sure we've got a little time left for Q&A. So who wants to start us off? I know there was some good discussion on artificial turf, but
there were a couple follow-up questions about the water piece. Laura is right that in drinking water, we are testing for 29 compounds, and the EPA is recently asked all water systems across the nation to test for 29 PFAS compounds. So we'll be getting more of that occurrence data across the nation over the next 3 years. In terms of the private well questions that were out there, DEP did do a limited amount of sampling of private wells in towns that predominantly didn't have a public water system. And it was a voluntary program, and they went out to those towns and offered to provide that free testing. I will say that because of the liability associated with having contaminated groundwater on your property, you would then be considered sort of 21E waste site. That was made very clear to those private well owners that that was a potential downside to testing the well. And so I imagine that factored into some of the participation in that program. But DEP does have the results from the private well sampling on their website, and I can paste that in chat or get it to you to distribute.
Other questions people have?
I think this could be a good time to follow up too, that we're going to hopefully continue these conversations. I know there's a slide for, I don't care if you had that or if it's Ryan, but yeah, thank you. So we will be continuing the conversation. You know, we have these roundtables every other month, and you know, we're going to break down the topics so that we could, you know, get a little more deep into these topics. I know everybody only had about 10-15 minutes, and that's just not enough time to cover everything. So in November, we're going to have another conversation about drinking water. In January about product specifications, and then in March, a topic that was brought up today that we weren't able to get to on deconstruction and remediation. And that specific topic, I'd love if anybody knows anybody that is experiencing, experiencing this firsthand and has ideas for solutions, or is hearing about solutions, or just firsthand dealing with the repercussions. I think it would be helpful, because that's, like we said, one that there's not a lot of information on, but it's so important. But I hope that many of you can return for these conversations, and we are going to be asking our speakers if they'd be interested in coming back on these days to see if they'd like to continue the conversation there as well. But I'll say for myself, I really enjoyed this. Thanks to all the speakers for making it work. I know the Friday after a holiday week is tough for everybody. So thank you again, and I'll hand it over to you, Meredith.
Thanks, Lindsay. I wanted to emphasize that this was an informative event where we're mostly talking at you, where the roundtables are just that, they're discussions where it's much more about 80% or more talking together. And so we're hoping, for instance, when we get to the topic of PFAS and drinking water, what are we as the leaders and aspiring leaders in the green building industry actually doing related to PFAS and drinking water? Are we testing? Are you installing filtration systems? What are we actually doing? And if you're dealing with that, what are the things that we're dealing with, and what are the things we should be looking at? Similarly with product specification, and similarly with deconstruction and remediation. We had a roundtable board discussion with contractors right before COVID. It was in person. And I remember distinctly talking with some contractors who were saying that the waste that was coming out of their buildings was being declared hazardous waste because of PFAS contamination. And that was actually the first time that I had heard that, and thinking about that it's not just what we're putting in the buildings, but it's actually going all the way through to when we're deconstructing this building, our buildings. And so the person who said that we have not been able to get in touch with. And so if you guys know of other people who are having those issues, we really would like to bring that up as a topic for discussion. I want to give a big shout out to Carrie and Lindsay and Gabriel for organizing this and all the effort they put into that. And then, of course, to all of you who helped to speak here. Some of you are new, some of you I have known for many years, like Mikhail, I think, and I met at Greenbuild probably, I don't know, 20 years ago now or something, or so. And so it's really great to have all you guys here and to have our local experts. And we look forward to collaborating more. If you want to see some of us in person tomorrow, we're going to be doing a green building bike tour starting up in Alewife and going along the new Green Line bike path, extension path, and ending up all the way at the Cisco Brewery in the Seaport for a party and celebration. It's not too late to register. And then another last reminder is that we have our annual Green Building Awards program. The Submissions are currently due on September 29th, and we hope that you will submit. We do have a health and wellness category. Projects do not have to be completed for that, and it doesn't even have to be a full project. So if there's one particular aspect that you're doing to try to get PFAS out of a building, that could be eligible for an award. And then we'll have the actual celebration is going to be down at Amazon's headquarters in the Seaport on October 26th. So an opportunity to celebrate all together, and looking forward to seeing some of you guys there. So thanks, everyone. There are a bunch of notes and websites and lists and links in the chat. So take a moment to pull some of those out. As said, we have recorded this and we'll be posting it on some of these announcements on our website shortly, because I think, you know, as the top number I saw that we had 32 people on here, and I think that this is something that we should have so many more people need to be knowing about, and that's just one of the big issues, is just awareness of this being an issue. And I know from personal experience, I try really hard to buy products that are PFAS free, and I'm excited that stores like REI and brands like North Face and others are getting you know, are having plans and going to make it easier and easier for us to, as consumers, to not necessarily even need to be educated, because it's just going to be the way that it is. So I'm excited about that. Thanks, everyone. And we'll hang on here for a couple minutes in case anyone wants to ask any more questions. But happy to have you all here today. Thank you.
Thank you.
Thanks, everyone. Appreciate it.
Thanks, everyone.
Have a good Friday.
Great afternoon.